a DNP FNP student at the University of Portland. I'm also a psychiatric mental health nurse practitioner working in public health. And I'm here today to be part of a project for the Graduate Nursing Student Academy to interview one of our leaders, in this case Joanne Warner, our dean, to just get her insights about nursing leadership and nursing in the healthcare system. So I'll go ahead and ask questions to her, and we'll start. So what's your name and what's your title?
Yes. I'm Dr. Joanne Warner. I serve as the Dean of Nursing at the University of Portland in Portland, Oregon.
And please describe your nursing work and career, and how did you get into the current position?
My best and longest contribution has been in administrative leadership. That has involved 3 schools and about 2 decades of work. That leadership is built on 2 areas of clinical expertise. One was inpatient psychiatric nursing, and from that I learned to appreciate and understand more deeply interpersonal relationships, mental health and processes, group processes, and then also community health nursing, where I learned to appreciate the larger picture and concerns for the population, concerns for the group and the community. I think in my dean role I pull from both of these clinical areas to provide the best kind of leadership. There's a great story about first thinking about being a dean. In one of the schools where I served, we had an in-house editor. She would review manuscripts that we were considering for publication. My articles were different, she said. They didn't sound like the usual quantitative methodology, and they had a different voice to them. She said, after reviewing one of my articles, she said, "You sound like a dean, but you're not a dean, so nobody's going to listen to you." It was a turning point for me because I thought, this is my voice. If it sounds like a dean, then I think that I want to be a dean. The fun part of that story is that she planted a seed for me to think about administrative leadership. I hadn't thought of that ahead of that feedback from her, but that was the very first time I started to envision what that could mean for me. I think the other foundational inspiration for my administrative leadership was completing my doctorate. I always felt not done. I felt as though I hadn't completed my preparation until I had completed my doctorate. I felt I deserved the opportunity to have a terminal degree. When I started my doctorate, I didn't have an exact vision of where it would take me, but I knew it was to a better place, and I knew that I would find inspiration and an enjoyment in that. My takeaway lesson regarding that story is that education is most always an open door, an open window, and we don't have to know where it will lead before we walk through it.
So the next question would be, how would you describe your leadership role in the nursing and healthcare field?
I think my best leadership characteristic is seeing the potential in others and creating an environment where that potential can blossom and flourish. I don't have to be the smartest person in the room. I don't have to be the most innovative. But as administrative leader, I think I hold myself to the standard of recognizing brilliance and genius and potential in others, and then working to support it, celebrate it, fund it, recognize it, and sometimes get out of the way so that their potential really can make a difference in the world. I delight in that. I delight in seeing others' potential become fully realized, and I think that's the best aspect of a leader.
The next question is, what are specific issues in nursing and healthcare does your leadership role address?
We have some significant challenges in the healthcare delivery system, as well as the nursing workforce educational system. There are more challenges than there are more. We don't lack for challenges in this area. I think what is most critically needed now is the ability to think differently, the ability to innovate, the ability to do more with less. There was a while that we just looked for more resources. If I had more faculty, if I had more clinical sites, if I had more scholarships to fund students, those are easy solutions. But more isn't happening in today's environment. So what is required is innovation and ideas about how to do things differently. Perhaps this refers back to my quest to see the genius in other people, to create an environment and a team where great ideas emerge from the group, from within the group, and that teams are nimble enough to try it, and the environment is safe enough to even allow some failure. And to fail, I think the appropriate thing is to say, whoa, we tried it, we gave it our best creative thought. Now as we evaluate it, it's not something to sustain, but we did it, and we did it in the spirit of quality improvement and possibilities. So it's not a failure. It's what we need now to close the gap between serious needs and resources that might sound insufficient.
What's the impact of your leadership role in health outcomes and healthcare systems? As we look, a lot more to healthcare systems, we're looking at health outcomes that we're funding, as we creating our care, or through pay or performance, but from your role as leadership and as a dean, students,
Yeah. It is a valid question to ask me the impact of my leadership, and it's a very difficult question to answer. I believe that in truth, we don't always know years down the road the lives we've touched or the impact that we have had. I feel more clear in explaining that I have touched the lives of faculty who have grown and been challenged and worked along on their journey. And I feel clear that I have touched the lives of students who have gone out and then been significant difference makers in the world, gone out to change policy, provide amazing care, be culturally aware, and just all of the things that we aspire to in a quality nursing program. I think that I will not know or be able to quantify the impact that I've had on healthcare outcomes. However, I rest in the assurance that if I can be a part of creating an environment where amazing baccalaureate graduates become registered nurses, amazing master's graduates become leaders at the clinical bedside and nurse educators, and graduates from our DNP program go on to not only provide excellent nurse practitioner care, but lead organizational change, translate evidence into practice more readily, then that's what I've chosen to give to the world.
How do you measure health outcomes from a dean position? But no, it's not, you're not in the clinics, right. You're not living, so you do that through knowing the quality of your students and how you train them to go and be able to do that, to have the knowledge too, because you do have systems, classes, you have translational research. So.
And I would also add that one of the recommendations from the IOM Future of Nursing report talked about 80% of the RN workforce being prepared at least the baccalaureate level or the graduate level. As a nation, actually as a state of Oregon as well, we're not at that 80%. However, I believe that what we do at the University of Portland and other four-year baccalaureate programs across the nation, what we do every year and with every graduating class contributes to help our nation meet that goal. I feel committed to a nursing workforce that's baccalaureate prepared, and am pretty proud and pleased that I'm part of the solution working toward that IOM recommendation.
Mm-hmm. Right. So the next question we'll have is, how does your leadership relate to local, state, and national priorities?
My leadership contributes to one of the IOM Future of Nursing recommendations. The recommendation that 80% of the nursing workforce be baccalaureate prepared by the year 2020 is important to me. I believe that recommendation will make a difference in health outcomes. I believe in the contribution of a baccalaureate prepared nurse. So as I lead a strong program that contributes around 200 new amazing BSN prepared students each year, I feel like I'm helping address that national initiative, and that we are collectively making a difference. Additionally, there's lots of conversation and lots of data that talk about the needs for primary care, or the need for advanced practice nursing to solve issues in the world, to give care, to increase access to care. So as I support and lead our graduate program, I also feel as though to work hard to prepare the most amazing graduates who can give quality care, who can affect health outcomes, who can increase access. That is addressing what we need. One of my scholarly interests is political competence for nurses. I think that the nursing profession needs a unified voice. We need the passion for speaking up about issues that relate to the profession and relate to healthcare. When I pass on that or inspire students with that passion, I believe that I'm helping contribute a solution by educating nurses who will speak up, nurses who see policy advocacy as part of their professional role, not as something incidental or a post-it note on the side, but something part and parcel to the kind of care that they give and their own professional identity. But those are the ways in which I believe my leadership and my actions match with some national goals, national needs.
I have a little extra question about this. I want to believe, correct me if I'm wrong, that the University of Portland has the DMV FNP entry degree, right? That you support the DMV FNP, which I do support, and many advanced nurse practitioners support, and that we are hoping that we can reduce the controversy and we can come up to some, as you were saying, a unified voice so that we can practice to the full, extent of our education. So my question is for you. You're probably aware of the a consensus model that in the LACE model that is hoping to reach some consensus and standardization by 2015. Do you think that's going to be possible that happens in the year 2015?
I support the goal of 2015.
Yeah.
That was a collective decision by the organization, the American Association of Colleges of Nursing, and I believe it is an important and valid goal. Building consensus across the nation takes time, and there are differing barriers and facilitators depending on each institutional context, state governments, and all sorts of factors. However, I'm an optimist, and my optimism resides in the fact that I believe the DMP preparation is what is needed to provide leadership and care in today's complex world. I'm pleased that the University of Portland saw this vision and transitioned from our master's program to prepare NPs to a DMP. We have both a baccalaureate entry, preparing family nurse practitioners. We also have a postmaster's program for those already prepared as a nurse practitioner to come and complete the leadership and the translational research and the other skill sets that are required to lead. So I know that 2015 is a challenge because of building national consensus. I have to say that I want to continue supporting the nation moving toward that important goal and think that health outcomes would be improved and the profession would be making the strongest contribution that we can make to health outcomes.
I think that would take care of the gaps, really.
Yes.
Because we can talk about the gaps if you want. The gaps, did you feel they are in the leadership?
When I think about the possibility of gaps in nursing leadership, I start thinking about the issue of age. There is a lot of data about the graying of the professoriate and the aging of nursing leaders. Yeah, it's happening every day. So I think a rising opportunity, I don't know if I would call it a gap, a rising opportunity would be for youthful leadership. It would be for young nurses who have a long career ahead to realize their potential and their joy in leadership. Perhaps administrative leadership, might be leadership in the service arena. And that in order for that to happen, sometimes people who have been in leadership roles for a long while need to step aside so that new energy comes forward. So I don't know if I would name it as a gap, but I would name it as an opportunity that is possible, because I know so many young students that have been a part, and graduates who have been a part of my life, have so much potential, and all they need is a place for it to be realized. It is the opportunity and the responsibility for everyone to contribute what they can, when they can, to bring your truth to the conversation, to speak up when that's your truth to speak, and perhaps to be quiet when you don't really have anything to say. If we each do that, if we each dare rise up when it is our work and speak up when it is our voice, then there is a balance and a harmony that says we are moving forward.
So we have two questions left, and one is to see if you have anything else that you thought you wanted to share that's not part of the questions, and then advice for the next generation.
Let me address advice to the next generation. I would say to each person to trust the process of their journey. One benefit of getting older is that you can see how your life has unfolded. You can see that you have prepared for leadership or some opportunity by doing things that you didn't understand at the time. Once you get older, you see, I've prepared my whole life for this, but I didn't know it when I was doing that role or that job or preparing on that research team or teaching that particular course. It all adds up to make sense. That's one of the joys of getting older, is to see that it actually does make sense. So my advice is to trust that that is happening, that your authentic life is unfolding as it should, and that if we show up and we're present and we're authentically engaged in our work, it's the right place to be. Another piece of advice would be to intentionally seek environments or communities or institutions where your values match the culture. That you can deeply align who you are with the work environment it reduces so much extraneous energy. You are passionately a part of the work, of the mission, of the vision, and that makes coming to work every day such a joy. It makes you feel like you can bring all of yourself to work. That's been one of the joys of my career. I feel like I can bring who I am. For me, it would be who I am as a mom, as a community health nurse, as a psychiatric nurse, as a Quaker, as somebody who has a political leaning. I don't have to talk about all those values, but I know that's the rich tapestry of who I am. And I like to come to work at a place where I bring all of that. And even if it's not visible in each conversation, it's the tapestry from which my work emerges. Let me say this about poetry. Poetry to me is part of our aesthetic way of knowing. It's part of seeing life as metaphor, and part of what inspires me. It's part of bringing all of myself to work. I started several years ago being more courageous about reading poems, and decided that I would continue to be courageous even though some may not appreciate or understand it. But even in those circumstances, it nudged people beyond what they were thinking to a more freed way of being in the world. It occurs to me that I have a poem that I could read now. I'm thinking about it as a potential inspiration for a poem to read to the graduating students, because I choose a poem for every circumstance where I'm speaking to students. And here is the poem that is currently the front runner for 2014 nursing pinning at the University of Portland. I love this poem because it talks about work and our quest to be engaged in meaningful work. It's called "To Be of Use" by Marge Piercy. The people I love the best jump into work head first without dallying in the shallows and swim off with sure strokes almost out of sight. They seem to become natives of that element, the black, sleek heads of seals bouncing like half-submerged balls. I love people who harness themselves, an ox to a heavy cart, who pull like water buffalo with massive patience, who strain in the mud and the muck to move things forward, who do what has to be done again and again. I want to be with people who submerge in the task, who go into the fields to harvest and to work in a row and pass along the bags, who stand in the line and haul in their places, who are not parlor generals and field deserters, but move in a common rhythm when the food must come in or the fire must be put out. The work of the world is as common as mud. Botched, it smears the hand and crumples the dirt. But the thing worth doing well done has a shape that satisfies, clean and evident. Greek amorphous for wine or oil, Hopi vases that held corn are put in museums, but you know they were made to be used. The pitcher cries for water to carry, and a person for work that is real. I love the relevance of that poem for nursing because our work is as common as mud, and our hands get dirty, our hearts get dirty, we can be stressed, but we are at our best when we are engaged with work that is real. That's the contribution we make to the world.